Did you know that over 96 million Americans have prediabetes right now, and most don't even know it? Doctors see it all the time, but instead of warning people, they usually just say, eat better, move more, see you next year. And that's kind of like ignoring a fire in the kitchen until the whole house goes up in flames. Hi, I'm Jared. I'm a registered nurse and certified health coach, and for the past 15 years, I've worked with thousands of diabetics. I've seen the damage that silence causes, and I can tell you, there are things your doctor isn't saying. So in this video, I'm going to reveal the 3 secrets your doctor won't tell you, and by the end, you'll know exactly what steps to take to protect yourself and take back control of your health. I help people lower blood sugar, cut back on medications, and finally feel like they're in control again. The first secret your doctor won't tell you is that diabetes doesn't start when you're diagnosed. It starts decades earlier, silently, with something called insulin resistance. As a nurse, I see patients come in for something completely unrelated, like an infection or injury, or maybe just not feeling good. We run their labs, their blood sugar's sky high. Most of the time, they have no idea. Nobody ever even told them they were pre-diabetic. And if they were told, it was usually a really casual conversation like, yeah, your number's a little bit high, eat better, move more, see me next year. But diabetes doesn't begin the day you're diagnosed. It's like a heart attack. By the time it happens, the arteries have been clogging for years. The damage from diabetes is silent. When you finally hit that magic number, it doesn't mean it just started. It means the damage is built up enough to qualify as a disease. Now here's what the numbers mean. Normal fasting blood sugar is under 100. Prediabetes is 100 to 125. Diabetes is 126 and higher. So when someone finally says, hey, you have diabetes, it's not the beginning of the problem. You've already been sliding from the high 90s into the 120s, then into the 130s, 140s. That's years of damage. Diabetes starts with insulin resistance long before your blood sugar ever even hits the pre-diabetic range. And there's a little known term called pre-prediabetes. It's the stage where insulin resistance is already at work, but your labs still look normal. Now here's the scary part. Over 90% of people with prediabetes have no idea. The early warning signs are so quiet that most people don't even notice until it's a full-blown diagnosis. But you don't have to wait for a doctor to label you as a diabetic or even a pre-diabetic. If your fasting blood sugar is consistently in the high 90s, if your A1C is creeping into the mid-5s, if you're spiking above 1 for meals, those can be red flags. If you add constant fatigue, stubborn belly fat, skin tags, or brain fog, and likely insulin resistance and pre-diabetes is already at work. If you want to catch it early and know exactly what to do about it, I put together a free guide called The 6 Steps to Reverse Diabetes Naturally. You can grab it for free in the link below in the description. It's the same framework I've used as a nurse and a coach to help people stop diabetes before it takes over and even reverse it after it does. The second secret your doctor won't tell you is that type 2 diabetes can be reversed. And most doctors only talk about managing it with medications, but people who turn it around don't do it with prescriptions. Over the years, I've noticed a pattern. Most patients try to follow the standard advice. Take your meds, eat less, move more, and come back next year. And for these people, things almost always get worse. They have more complications, need more and more medications, and have less hope year after year. But a small number of patients take a different approach. They focus on habits, not just prescriptions. They're not perfect, but they're consistent. And the results show it. Lower blood sugars, fewer meds, fewer complications, and more energy. That's the part your doctor probably won't emphasize. Simple lifestyle changes don't just control diabetes. They can actually help reverse it. And in many cases, reduce or even eliminate the need for medication. Here's the problem. The medical system is built around prescriptions and appointments, not lifestyle change. So while most doctors have time to hand you another prescription, most don't have the time or training to show you how consistent changes in the way you eat, move, and live can actually turn your type 2 diabetes around. And that's why so many people never hear this truth, because the system is designed to manage disease, not reverse it. Third secret your doctor won't tell you is that the damage doesn't wait for the diagnosis. It starts years before anyone officially calls you diabetic. I've seen this over and over. A patient comes in for something unrelated. When we check their labs, they're barely in the diabetic range or still labeled as pre-diabetic. Most of the time, it's ignored. If it is mentioned at all, it's just a line buried in a progress note. The patient never hears a real warning. The problem is, complications don't start overnight. Nerves, blood vessels, and organs are being affected quietly, long before the official diagnosis. You might be told that you're borderline or just a little high, but your body's already paying the price. Nerve damage, vision changes, kidney stress, and even liver fat all begin while you're still being told you're not diabetic. That's why catching it early matters. If you act while you're still in the medical gray area, you're not just preventing diabetes, you're protecting yourself from complications that can destroy your quality of life. And that's why this matters for you. If your numbers are creeping up even a little, now's the time to act. Don't wait for the official label. Don't wait for the complications. The earlier you step in, the more damage you can prevent, and the easier it is to reverse. So now you know the secrets. But what are you going to do now? I put together a free guide called 6 Steps to Reverse Diabetes Naturally. It walks you through the exact lifestyle changes that have helped me and my clients to lower our blood sugar, lose weight, and take back control. You can grab it for free right now in the link below in the description. Before you go, watch this video, The Ugly Side Effects of Ozempic No One's Talking About. I'll see you in the next video.